Okay, this is the title slide. Are you ready to go ahead?
Yes, we are.
Yes. Yes, please go ahead.
Welcome, everyone. I'm so glad to be giving this brief talk about a revolutionary advance in cancer management to all of you in Lahore, Pakistan, from Houston, Texas, where it is 6 o'clock on Saturday morning. This is a very important subject. It is probably the most rapid advance and important advance in the history of cancer research. And while these advances during the last 5 years have involved patients with advanced cancer of many types, it is already reaching the arena of the surgical patient with cancer. So I think it is very important for everyone who practices cancer surgery to understand that this is a very important part of cancer management, that in the future, sometime in the next 5 years or sooner in Pakistan, that these kind of extraordinary treatment modalities will reach your practice and you will be hearing about it. So I thought it would be important to go over some of the principles so that as you read about immunotherapy in the literature and as it starts to come to your practice of surgical oncology, that you can understand some of the basic principles about immunotherapy and how in the future it may apply to your patients. Now, here's a summary about how and why immunotherapy will be used in the surgical oncology arena. In the very near future, around the world, immunotherapy, and I'll go over the details very soon, will be used either before treatment, before surgical treatment, or in some cases after surgical treatment in patients with advanced, say, stage 3 cancers. It also, as I'll show you as some examples later on, is so powerful that it can downstage patients who are inoperable, reduce the size of their tumors, and make them into candidates for a safer operation. In addition, I predict that we as surgeons will be doing more surgery even in patients with stage 4 cancers in order to remove any residual masses to determine whether there is any cancer remaining or whether the mass that we're measuring from the outside is scar and inflammatory tissue resulting from the rejection response from immunotherapy. And of course, this is not going to be a substitute for current standard treatment, but will be used in combination with standard molecular therapy, endocrine therapy, targeted therapy, either before or after surgery. Now, here's a key point as you hear about immunotherapy, that this form of treatment modality does not treat the cancer directly. Molecular therapy, targeted therapy, hormone therapy, the things that you are using in your practice directly attack the cancer itself. However, immunotherapy treats an abnormal immune system that is in a state of tolerance, which I'll go over in a few minutes, and allows the immune system to do what it should be doing in the first place, to identify cancer as a foreign substance and cause its elimination. And of course, this is the ideal personalized therapy because we're unleashing the immune system in each individual patient to treat its own cancer and its own unique set of mutational advances that caused the cancer in the first place. Now, as all of you know, there are different types of immune therapy in cancer control. Vaccines, cytokines such as interferons and interleukins, adoptive cell therapy, and immune checkpoint blocking antibodies. So the rest of my talk today will be about what's called checkpoint blocking antibodies, because this is the area for which there has been the most rapid advance in treating human cancers. So here's the basic concept, is that all of our cancer patients, including yours in Pakistan, develop their cancer clinically that you see as a surgeon because the cancers have learned to induce a state of immune tolerance so that the immune system does not recognize the cancer as a foreign invader. So the key strategy for treatment is that we now have the tools to break tolerance so that the immune system can reject the cancer as a foreign invader, just as it would for a kidney graft in a allograft, as it would for a virus or a fungus or a parasite. It's the T-cell mediated immune responses that are responsible for recognizing cancer cells as a foreign invader and eliminating them in a standard rejection response. So think about it this way, that what the cancer has done is the opposite of an autoimmune disease such as ulcerative colitis, when we normally have tolerance to self-antigens. That's why we don't have autoimmune disease, because our immune system is in a tolerant state to normal or self-antigens and doesn't recognize our normal tissues as a foreign invader. But if that tolerance is broken, then we get an autoimmune disease such as ulcerative colitis, rheumatoid arthritis, and other autoimmune diseases. So what a cancer has done is the opposite of that by inducing tolerance in order to survive. I thought that this example, so if you allow me to go into another area just to understand what tolerance is about, because this concept was very important to me when I took my grandson Colin. So over here is me with my grandson Colin at a baseball game. Colin, who's 12 years old yesterday, is allergic to grass. And the treatment for someone who has a standard allergy, such as dust or grass or other allergens, is you go to the allergist and get low doses of grass in order to induce tolerance so that your immune system won't recognize it as a foreign invader. And what was insightful for me when I took Colin to the allergist and the nurse gave him his low dose of grass, she said, "Now, Colin, it doesn't make a difference how much grass you're exposed to. Your immune system is tolerant and will not recognize it because you are in a tolerant state." And I realized when she said that this is exactly what cancers do in order to survive. They induce tolerance. It also explains why over the years we've tried to stimulate the immune system in a tolerant state with vaccines and other immune stimulants without any response, because if the immune system is in a tolerant state to their cancer, it doesn't make a difference how much you stimulate it, it still will not recognize the cancer as a foreign invader. But on the other hand, if you can break tolerance with these so-called checkpoint inhibitors, then you unleash the immune system. It is no longer tolerant. It can recognize cancers as a foreign invader and eliminate or reduce the size of the cancer in a very effective manner.